So to show off our survivorship functionality, I'm going to activate a new patient in the list. I'm going to go to the new patient work list. I'm going to search for a patient with a diagnosis of breast cancer. What the software is doing here is extracting all the patients who've been registered in your oncology information system and with a diagnosis of breast cancer. I'm going to pick Mary here because she was referred to me for survivorship, and I'm going to click on the Set to Active button. What the software is going to do is it's going to walk me through this multi-step wizard with the end goal being the creation of a survivorship care plan for Mary. I'm going to save that, and now I've fully activated the patient in the system, and the software has pushed me over to the second tab in the workflow, which is all about capturing referrals. The goal with the referrals tab is simply to identify the different sources of referrals within the system for Mary. So I want to capture, for example, that her family physician referred her in for surgery to see Dr. Carter. So I'm going to save that now, and the software is now going to present me with the care team view. The good thing is that this is fully automated in the system, so we've already captured all the contact information, emails, phone numbers, etc. for the different providers. So I'm going to go on to the next tab, which is the treatment summary. The nice thing about our product is that this is a fully automated process. We're extracting the treatment information automatically from your oncology information systems. So we're also keeping this information up to date. As the patient progresses through treatment, additional records are added. Next step in the process is to set up the patient's follow-up plan. And here's where we're starting to reference the oncology library of guidelines. So I've picked breast cancer because that's Mary's diagnosis, and what I'm showing here are all the different NCCN follow-up guidelines for a breast cancer patient, and my goal here is to assign those that are appropriate for Mary based on her diagnosis, on her the type of treatment she's had, perhaps on some of her risk factors. So I'm going to just pick the basic breast cancer guidelines. I'm going to identify the start date as today, and I'm going to say I want that to carry on for, let's say, for 10 years. The next step here is to create an education program for the patient. So if I sign that, now this information is available to Mary online. It also becomes part of her printed plan, which I'll show you shortly. The next step here is to set up questionnaires for the patient. So in this case, I'm going to assign a distress causes questionnaire. Maybe I'll give her a quality of life questionnaire. The next step then is to print all this information off. So the last step in this wizard then is to set up reminders for the patient. And the goal here is to provide another way to ensure patient engagement. And when I update that, now I've got the patient fully engaged in their survivorship care.